There remain a lot of unknowns about the potentially deadly coronavirus since word of it first began to emerge from China on New Year's Eve. Dr. Michael Gardam is going to help explain what we know and don't know. He's chief of staff at Humber River Hospital, and he's a specialist in infectious disease. Dr. Gardam, China, which is the epicenter of this virus, has shared the genetic sequence of it. Why is that important?
It's really important for a couple of reasons. One, that's what the molecular testing is based on. So if you have the sequence, then you can develop a rapid test to be able to diagnose people with it. And the other reason is really to do more basic science, looking at how similar is this to SARS and MERS and other coronaviruses, and also to tease out if there's any genes that relate to specific virulence factors, so things that make you sicker because that organism has that particular gene. So all that work will be going on in the next several months.
What's the most vital thing that scientists and specialists need to know about the virus in order to try to control its spread?
First of all, the most important thing was to have a diagnostic test, which we now have, so that's very good. But I think right now the most important thing is exactly how contagious is this. If this virus becomes as contagious as influenza, for example, then all the control measures we're taking aren't really going to slow it down. If it remains the way it is, which doesn't seem to be terribly contagious, then I actually think we have a pretty good chance of actually stopping this outbreak over the coming month or so.
Well, let's talk about how contagious we think it is now. Do we know how long it takes for symptoms to develop?
We don't have a good answer for that yet, but the sort of the outer limit is believed to be 2 weeks, and so that's what we're saying. If somebody's traveled to Wuhan City in the last 2 weeks, we would look at them. For likely many people, it's going to be shorter than that, but it's likely not going to be longer than that.
And do we know that whether they are contagious possibly before symptoms begin to appear?
You know, we really don't know any of that yet. I'll say for other viruses, we know that people typically start shedding the virus typically several hours, maybe a day prior to the onset of their symptoms. But the amount of virus is usually pretty low. Once they start to develop symptoms, typically the amount of virus increases manyfold, and they also have symptoms at that time. So typically we think of people being the most infectious when they actually have symptoms.
And is there a definitive test right now that can be done to determine whether they have it or not?
There is a definitive test, and that's really one of the remarkable things about this. Before this virus has even landed in Canada, we already have a test for it. And if you think back to 2003, we went through most of the SARS outbreak without a test. And so this is one of the reasons why we're miles ahead today than we were back then.
Okay, well, I learned a lot from you. Dr. Michael Gardam, a specialist in infectious disease. Thanks.
You're very welcome.